Welcome to the Get Trauma Informed podcast, dedicated to unraveling the complexities of trauma, its pervasive impact, and the journey towards holistic recovery and realignment. If your radiance has ever felt muted, like I and thousands of others, you're in the right place to reignite your inner light. I'm your host, Wellness Coach Liz Blanding, and this is the Get Trauma Informed podcast. Well, on today's episode, I am very excited to have this conversation with my esteemed colleague, collaborating partner, and just amazing all around, Dr. Carrie, Dennie. She is a naturopathic doctor, and actually she's a licensed naturopathic doctor, a doctor of naturopathic medicine. And the Get Trauma Informed podcast and movement is all around holistic wellness. So today, we are going to have this wonderful, amazing conversation just to enlighten some and just to educate you on how we work so well together. So without further ado, Dr. Dennie, how are you today?
I'm doing good. How are you?
I am doing good. I have long waited for this conversation.
Thank you for having me.
Oh, I thank you so much for being here. I'm going to right off the rip, bounce the ball into your court so you can just enlighten everybody as to who you are and what do you do.
Yeah, so like wellness coach Liz said, I am a licensed naturopathic doctor and I'm also an acupuncturist. I work in Grand Rapids, Michigan, and my practice Vibrant Wellness. And so I'm really just a big advocate for whole body wellness, and I have a myriad of ways that I help people achieve that or maintain that wellness, I'll say, and just improve their health overall. So that's a really basic description of me and what I do.
Well, all right. So we are going to have a fun conversation around the whole Get Trauma Informed movement. So my first question to you is, what does Get Trauma Informed mean to you?
I think being trauma informed is being open to and understanding the importance of someone's life experiences in order to, again, better support them in their health journey or just whatever journey that they're going through, right? Because trauma, there's definitely different levels of trauma. There are different forms of trauma, right? Physical, mental, emotional, spiritual, um, financial, right? There's just so many different forms. And so the fact that we understand that, again, helps us shape how we help the people that come to seek our care.
I love that. I love that when you said, and I think that's something that's overlooked, how well we understand that and the different facets and a different way that trauma shows up. And again, that's what this whole movement is about, for us to all really get an understanding, because I think there is a lack of knowledge or information surrounding the Get Trauma Informed or that movement. So I thank you for clarifying that for us as well. So let's get a little bit or deep dive into what is the difference and how would you explain the two different paths of becoming a naturopathic doctor? There are so many questions surrounding that, and some people go into, some of the trade schools, some of the different paths, and don't really get a clear understanding.
Yes. So first, I just want to say that both licensed naturopathic doctors and traditional naturopaths have the same aim, right? They both are aiming to help people heal their bodies through natural substances, right? So things like food and herbs and water, and beyond, right? Because again, there's a myriad of ways to do that. And so that's one of the common threads that I think is overlooked kind of in general in medicine. Naturopathic medicine in general is re-emerging in the United States. In other countries, it's well known and well used. The history is long, and the history is long here in our country too. But at a certain point, and I don't know if you want me to get too deep, but at a certain point in our history, you said do it. Okay.
Go
So
deep.
in the early 1900s, let me back up. Prior to the 1900s, you could see any type of doctor that you wanted to see, right? So you could see a chiropractor, you could see what I call a conventional medical doctor. You could see a naturopathic doctor. You could see what is called an eclectic. There was just many different forms of medicine, and you could see who you wanted to. In the early 1900s, there was a gentleman who was tasked, I believe, by the Rockefeller family or the organization to go around and survey all the different medical schools and then to come back and give his recommendations as to which one is the best for whatever reason. Um, Me personally, I definitely think it's money motivated, but who knows? So anyway, this man came and or went and looked at all of the schools, and then he published what's called the Flexner Report. And if you Google there's an entry for it on Wikipedia, like it is a thing. And he determined that what we now know as conventional medicine was the best way. And so as a result, there was this movement, this kind of shift in medicine, and you could no longer see who you wanted to see. You basically only had to see a conventional medical doctor. And so right, you think about medicine now. Well, Dr. Carrie, you may say there's chiropractors now, like how did we get here? So it has definitely been a journey. Even osteopathic doctors or DOs, they were not considered conventional medical doctors back in that time. They had to fight in order to get their legitimacy, we'll say, or their legacy. Same thing with chiropractors. They more recently went through that fight, and that's what's happening now in the United States with naturopathic doctors, is that we are trying to, again, be licensed in all 50 states and all the territories and be able to, for our clients to be able to come and utilize us. And so I say all of that to say, so in general, I feel like in medicine, there is a little bit of a stigma, if you will, right? That if you're doing something that is alternative, in air quotes, that it's almost like you're trying to harm somebody. And that's not the case. I feel like for healers across the board and whatever medium you use, that's something that we need to keep in our minds, is the fact that these people are signed up, they paid their money, they did what they did, they learned the things that they learned in order to help people. And so that's another thing that I just want to highlight in regards to licensed naturopathic doctors as well as traditional naturopaths, is I don't believe that anybody who, again, is going to take their time and their money and their effort and learn these different modalities in order to harm somebody. So just wanted to put that out there. But to answer your question, so the difference is, honestly, there's multiple differences. The philosophy is very similar. Like I said, we all want to heal people and help them heal themselves using natural substances. The differences a lot of times are in the education. So as a licensed naturopathic doctor, I attended a 4-year accredited by the U.S. Department of Education university, and there are, I believe, now 6 or 7 in the United States and Canada included. And I learned all of the same basic sciences that conventional doctors learn, including pharmacology and just all of it. I was in the anatomy lab, I remember, for 450 hours the whole time I was in school. I calculated it because that was a long time.
Yes,
Um,
yes,
and it
yes.
was also a beautiful experience, and I really enjoyed it. But we learn nutrition, and then we learn all of the natural things. So we learn homeopathy and botanical medicine or herbal medicine. We learn a little bit about Chinese medicine, even though I took that a step further and I got my master's in acupuncture. But we learn clinical decision making, like you name it, we learned it. And then as a result, we have a supervised clinical internship that we do at the end of our time at school, and then we are able to go off and either practice, or if you feel like you want more support, you can always do a residency. So that is licensed naturopathic doctor education. In comparison to traditional naturopaths, a lot of times their programs are primarily online. There may be like a hybrid. I know that there is a school that is in Michigan, kind of central Michigan. I can't remember where, but they are primarily online, and then they do have weekends where they go and actually go to the school. So that's another thing that is different. The other thing that's different is that the curriculum that licensed naturopathic doctors learn is standardized. We do have to take 2 board exams. They were treacherous. One in between you learning your basic sciences and the clinical sciences, and then once you graduated. And then from my understanding, I don't think that traditional naturopaths have a standardized curriculum, and I don't believe that there are um, exams that they have to sit for in order to practice. Um,
Right. I want to interject
however,
in
oh,
there
go,
just a little piece in there as well. And it also depends on the school that you attend, whether it's online or whether it's offline. I did both, a mixture of online classes and then in the actual classroom. And in some programs, you do have to pass exams and such. You have to learn the anatomy. You have to learn the different herbs. So there are, curriculum. So I just wanted our listeners to understand that, it's like your choice, your decision. When you go into naturopathic medicine, you can decide. In some states, like you said, um, the push is to get it regulated, to get the industry regulated where it's not regulated. So that's a good thing to understand. There are hours and hours and hours of studying and, again, learning the anatomy, learning the herbs, and, learning the properties and usage, and, the bodily influence, and, just learning the whole, how the body, what a great mechanism the body is. So it, again, it's about, and I love the fact that it's about your choice. What resonates with you, and how dedicated you are going to be to your education, and to what. But like Dr. Carrie says, there are many paths available, but I think it's I truly believe that naturopathic medicine is a calling.
mm-hmm.
The herbs actually, they have a nature, they have a spirit, and they talk to you. I was not even interested in anything. I wasn't interested in the naturopathic world because I didn't know it existed when I first started and jumped in. I had no clue. But if you go back to some of the other podcasts, I talk about my story and my journey, and it was my accident that threw me into naturopathic medicine, because I did not like the prognosis, and I did not like the side effects of pharmaceutical medication. The side effects, even before I started studying naturopathic medicine, the side effects scared me more than what was going on with my body, to be honest. And so again, and I'm so happy that I did, not the accident, but I'm happy that I did change courses. And I'm glad that I went through the study and the education, the learning the body. I'm glad that I did all of that, because I truly met my purpose. And when I talk with you, Dr. Carrie, that's the thing that I see and resonate with you, is that you are called to do this. You love to do this. It's your purpose, right? And so
Yes.
that's a huge difference. So just wanted to interject that, because I know I have some listeners that say, well, I want to go into naturopath, but the paths are never really clear or never really spelled out for us. So
I agree with that. I was also going to bring up the fact that in other countries, their paths. So, in other countries, there are multiple paths too. And I know, for example, in Australia, naturopathic medicine is humongous. You could actually get a bachelor's in it and practice with it. Um, and so, again, I agree with you 100%. Like, you need to figure out what resonates with you, which path resonates with you. Um, and think about what your end goal is. So, Coach Liz and I talk about this all the time, and I don't know if you shared this on your podcast, but she was so grateful that we were able to meet and interact with one another, because I am huge all about practicing and doing clinical care for clients. And she has expressed that that's not necessarily the passion that she has for naturopathic medicine. She is more into the herbs and just creating things, and
teaching,
so and teaching as well. Yes,
teaching
I
part,
forgot
that's the
about
passion for me, right?
yes.
And like you were
Yes.
saying, you love the clinical portion. And so it's like a perfect marriage, honestly. We can stay in
Yes.
our own lane and provide such a great service to our wellness community.
Yes. One other thing that I was going to say too is, so that's what you need to decide if you want to go down the naturopathic route in any form, is what do you want to do? What's your end goal, right? I've always, from as long as I can remember, I've always wanted to be a doctor. I've always wanted to see people and help them feel better. Thankfully, my journey led me to naturopathic medicine, and I feel so fulfilled in finding it. And like you said, it's definitely my purpose. But and I'm glad that I did my research back before I went to medical school, because like you were mentioning, there is a big push, and like I mentioned too, there's a big push to try to get naturopathic medicine licensed in all 50 states of the United States. And so if that happens, potentially, depending on what the legislature says, traditional naturopaths may have a harder time seeing people clinically because of whatever regulations will be established as a result of that legislation. And I think, and I don't want anyone to feel like, oh, you know what I mean, that the licensed naturopathic doctors are trying to like crowd people out or anything like that. It's more so regulation so that the safety of our patients and clients is paramount, because that is definitely a big part of our philosophy, is that, you know, we want to do the least amount of harm. And so regulation and having standards and having a clearly defined box to be able to practice in, I think, is the goal there. And so again, I say all of that to say, if you are considering, definitely think about what your end goal is. If you don't know where to start, I will definitely send Coach Liz some websites that talk about the difference, and so that you can start doing your own research, and then look into the curriculums of the programs that you're looking into. Right? Is it teaching you the stuff that you're interested in? Will it help you reach your goal? If it will, then that sounds like that's the right program for you. And then if it's not, keep looking.
Yeah, yeah. And you know what? Oftentimes, things that happen to us throw us into our purpose. So we're talking about, the Get Trauma Informed movement. So, when we talk about trauma, trauma affects you down to your cellular level. It even changes your DNA. It changes the way that your mind is constructed. So trauma is not just something, and I think we just take it so lightly that we don't really understand. We don't have an awareness of what trauma really is and how it really affects us. So if you are going, if you are looking to put together your own self-care plan, like a recovery plan, if you're looking to put that together, then seeking a holistic naturopathic way, it is about education, and it's about educating yourself. And that's how I found my love for naturopathic medicine, was trying to figure out what can I use for circulation in my legs that don't have a toxic effect, or something that doesn't have a harmful preservative in it, because I needed, so because of all of the extensive injuries I had. I mean, it was like a plethora of prescription medications, but each one of them may have had 15 different side effects. And I for myself, that just wasn't something that I wanted to endure, and my body rejected prescription medication. So I was constantly, no, this is not working. It's making me sick all day long. So just finding what, the naturopathic way, the different herbs, like I said, and finding what helped me to create the soothing salve was another pull on what brings blood to the surface, because we know blood helps you to heal. What can, what's for circulation, and what's for this excruciating pain? How do I get rid of that without swallowing pills and all of that? So that's how you can wrap that around, or wrap that back to the trauma informed movement. A holistic practice and learning that kind of pulls you out of that that fog, because sometimes it's a fear, right? And if we have a lot of fear, we know one part of the 5 principles of healing is to come out of fear, right? And so coming out of fear will help your body to start to recover and realign. So that's how I put it into the conversation of trauma, because so many people are suffering from traumatic incidents, whether it's, PTSD or complex PTSD. There is a way for us to realign and recover in the holistic realm of things.
Stay with us. We'll be right back.
Today's episode is sponsored by Oasis Wellness Center's home of Soothing Salve, an organic pain relief salve infused with over 30 natural herbs. It fights inflammation, provides pain relief, relieves stiffness, relieves dry and itchy skin, and it also improves circulation. Oasis Wellness Center's mission is dedicated to relieving pain, promoting relaxation, and restoring mobility. In order to grab your jar today, contact us at www.oasiswellness.com wellnessctrs.com. Now we return to our Get Trauma Informed conversation.
Yes, yes. I think and I believe in our holistic realm, we just have more options for people that are trying to recover. It's one thing to, and again, everyone is different. Every form of medicine definitely has a place, but it's one thing to get put on some prescription medicine for anxiety or for depression and to go see a therapist. For some people, that's really helpful. But for other people, that might not be enough. Or like you said, maybe their body is not resonating with the medication that they're on, or maybe they just don't have a great therapist that understands trauma, right? And so like but like you said, there's just so many different aspects. If it affects our bodies down to the cellular level, what is it doing to our spirit, right? What is it doing
Right.
to our mental state and our well-being, beyond just having the trauma? What is it, how is it affecting the way that our brains are working? There's just so many facets. So
Absolutely,
yes.
absolutely. Well, that's what drew me here. Like I said, into the Get Trauma Informed movement. It was unraveling, like peeling an onion open. It was the one thing that led to another, the physical pain, and then the not being able to sleep, and then, again, like I said, the post-traumatic stress, the complex PTSD, the what is it, fight, flight, or freeze response that I was in all the time. And that threw me
Constantly.
right. And it threw me into understanding, wow, there's such thing as a trauma recovery coach. I had no clue. And then I look up and I'm studying and studying. And okay, now then I became a trauma recovery coach, then learned about addiction and how that affects your body and
Yeah.
all of that. So then, okay, wow, I guess addiction recovery coach, abuse recovery coach, and then all of these different, things, all these different avenues opened up for me. But that was my path, and it's still an amazing journey to understand even more modalities like you and the acupressure, learning about, some of the things in all of the different modalities. We're going to talk even further about, about the phototherapy, how
Mm.
that works and how that helps. So and our point is, there are so many different modalities, different avenues, but the biggest thing is to start educating ourselves. And I say, well, start now fresh, grab a journal and just start taking down some notes, because we're going to drop even more nuggets as we continue, the holistic naturopathic conversations. Let me ask you something too. How has trauma empowered and inspired you, Dr. Carrie?
So, if I think about my own story, less eventful than yours, but kind of similar in that I had been dealing with this health condition since I was a teenager. I was kind of on the meds, right? Didn't understand. I remember asking the PA that I was seeing at some point, is there anything else that I can do besides this? And she was like, no, right? And I was like, well, really?
Didn't
There's nothing,
resonate, did
there's
it?
nothing else? Like, okay. And again, it was not horribly traumatic in the way that we think of when we think trauma informed, but it was a blow to my psyche. It was a blow to my spirit a little bit, because I'm now frustrated. I'm having to do this thing that I don't want to do. I've There's no other options. I'm kind of just stuck in this place, right? Like I was going through mental turmoil as a result. And so I feel like that's kind of when I started awakening to the fact that there's more than just what I knew, right? And then I did my research. Like I said, I actually reached out initially to a traditional naturopath when I first started my journey, and unfortunately she never got back with me. But
I got back to you.
yes, you did. You are not the woman. But I just started to educate, like Liz says. I started to educate and I understood that there are multiple factors that are affecting our health. And I wasn't able to articulate it back then, but it was just, again, my mind was opening up. And so when I did learn about naturopathic medicine and I started looking into schools, it just resonated with me so much. So, also as an acupuncturist, right? If we're talking about ways in which trauma can affect our bodies, acupuncture is all about balancing energy that makes our bodies animated, and it allows us to do what it is that we need to do and our organs to function. And so if trauma can affect us physically and mental, emotionally, and spiritually and financially, it can totally affect us energetically. And so I think, like I said, unbeknownst to me at the time, I wasn't able to articulate it, but I just instinctively knew that I needed to find a way to help people from multiple different avenues, and especially people that have trauma. So,
Absolutely, absolutely. But I love what you said, though. You said a couple of key points that just resonated with me just now. You talked about awakening, coming
mhm.
into that awakening, and that's what happens. Sometimes we're just tossed to and from, and we go to a traditional doctor and we hear a prognosis, or we hear and we're stuck there.
Yeah.
Had I really just stopped and listened, I mean, in all transparency, that's what I do. I'm transparent, but I was marked the rebellious client, the patient. I was not,
Mm.
because I had a feeling just inside of me. There was more. There was more than me sitting in a wheelchair popping pills all day, drooling and not being able to walk. That just did not.
Mm.
That didn't resonate with me. And they kept telling me, if you don't accept where you are, you're not going to get any better. And I kept saying, if I accept what you're telling me, I know
I.
I'm not going to get better.
Mhm.
And so that just pushed me. And you said opening up your mind, that threw me. I
Mhm.
had I had small children at home. I had to climb up out of this.
Mm.
I could not just say, okay, this is my lot in life. I knew that that was not my destiny. And that's why that my children pushed, they knowing that I had to get better for them, and just knowing that just God didn't give me that as my destiny. I said, there was more to it than that, more to my
Yes.
life than that. And so it's
Yes.
in a state of mind, and we're going to bring mindset coaches on. We're going to talk even deeper, because that point that you talked about, it affecting your mind, your body, your spirit, your finances. We're going to even go deeper to the soul, because your soul
Mhm.
fractures in trauma. And we have specialists that are coming on, and we're going to talk about that as well. So we're going to keep this conversation going. Dr. Carrie, one other question. What would you say to someone faced with trauma?
So it kind of depends what the trauma is, right? But in general, I would definitely say seek help, right? And even if that is going to a conventional medical doctor first, just so that they can stabilize your body, if this is a physical trauma, right? Because if you get hit by a Mack truck, please don't roll up to my office. I can't do much for you. That's where, honestly, that's where
Yes.
conventional medicine really shines, is with acute trauma to the body. If there's something going on acutely, again, if you've been in a car accident or anything, you want to go and make sure that your body is stabilized, right? But don't stop there. You honestly, I talk to my clients all the time. Create a healthcare team. Create a force of people that will support you in multiple different ways and different levels, right? So you may have your conventional doctor for the acute trauma. Then you may want to find a licensed naturopathic doctor who will help you heal from that trauma more holistically once your body has been stabilized, right? Then look for a therapist that is trauma informed and understands the impact of trauma. Low key, just jump into the Facebook group, listen to this podcast, and learn about all the different experts that will be coming on that have their own niche, or their own, all I can think of is expertise in
Yes.
their field, right? Because like we both have said, if you don't know about something, how can you seek it out, right? And there's just so many different facets that I don't think people understand to trauma. So again, start with getting yourself back stabilized, and then support your mental, right? Consider supporting your spirit. Consider supporting your energy or your energetic balance. Consider supporting your finances. Um, it's just so many different facets. But like I said, I think one of the major resources is this podcast, and is all that we are working on to be able to support people, and again, in all the different areas that need to be supporting in regards to trauma. So that is my advice.
Absolutely. And I thank you for that, because we will, within the Oasis Wellness Centers, we're going to put together a directory of supportive experts, coaches, that can help us to understand and to put our self-care plans together and to be successful in this journey. So this has been so much fun. I can't wait for you to come back. I thank you so much for giving up your time, your talent, your expertise. And you all, we are just beginning. You have not seen anything yet. So again, a round of applause for Dr. Carrie Dennie. I thank you. Woo!
Thank you for having
Thank
me
you
again.
so much. All righty. Bye for now.
Bye.
It's time to buckle up. No more suffering in silence. Our Power Pack journey to recovery and realignment starts now. Remember, you were collateral damage on someone else's warpath. Trauma is not your fault. Recovery, however, is your responsibility. I'm your host, Wellness Coach Liz Blanding, and this is the Get Trauma Informed podcast.